Hello there, at the end of another week, it's time to take stock a little bit of what exactly is happening with coronavirus. Now, it has to be said, India adding something like 10,000 odd cases every single day. And that's starting to take India into a somewhat worrying territory. We will almost certainly be among the top 4 or 5 countries in the world with coronavirus, in terms of coronavirus cases, at least in about a week or so from now. The problem is that while we are having a growth rate of about 4.5%, 5%, and that's been the range now for a fairly long period of time. If you look at the last 8 to 9 days, in cases in India are growing at about 4.5% every single day, which means that absolute number of cases will continue to rise. The problem in India is that we've got fairly high absolute numbers, 226,000, and yet we are growing at 4.5% a day. And that's only happened with a handful of other countries like the USA or Brazil or Russia. So cases are going to continue to mount, and that is a source of some concern. Now, that's at the national level. At the state level, there are many states who are being able to fight coronavirus really well. So hats off to them and compliments. There are some states that have very high absolute numbers like Maharashtra or Tamil Nadu, but there are some signs. Is growth rate starting to come off or not? Well, early in my view to really say that. Bigger concern are states like Delhi, where you're seeing a growth rate of about 5.7% or thereabouts of growth of cases every single day. And yet the absolute number of cases is very high. It's something like 25,000 cases in Delhi. Now, part of the problem in all of this is going to be if state governments take the decision that, we don't want to report too many tests, too many cases. Let's just reduce the amount of testing. And that's the absolute worst thing that you can actually do, because by reducing testing, you have no idea what's happening with coronavirus, and it will spread and it will lead to deaths. Instead, what states should be doing is test as much as you can, do contact tracing, and make accurate forecasts for what is likely to happen. Now, there are many private players who have been doing this. Parag Kar, for example, we've often spoken to you about some of the numbers that he's been putting out. And I just want to take you through some of these numbers. This, for example, are what the numbers could look like. Let's say you take the last 3 or 4 days average growth and forecast what the numbers will be in different states about 30 days from now. Now, you can see that a state like Maharashtra could end up with something like 178,000 cases within 30 days. And that's because average growth is about 3.5% in the last 3 or 4 days. Delhi could actually see a really big spike, because Delhi for nearly a week now has been growing at about 6%. So Delhi could see 104,000 cases within 30 days. Tamil Nadu could see nearly 90,000 cases. Gujarat about 34,000. And a state like Karnataka, which right now is not really being affected by the coronavirus, may well find itself at a level of something like 30,000 cases within 30 days. And that's because growth rates have been high for the last 5 or 6 days. Now, if these particular numbers and these trends go, India itself as a whole will see about 650,000 cases actually by in about 30 days' time. Now, there's nothing sacrosanct about these numbers. This assumes that growth rates will be as they have been for the last few days, with maybe some small correction, 80% correction. If we are able to flatten the curve, if we are able to take decisive action, then it is possible that the numbers will be much better than this. If we aren't able to flatten the curve, and as the lockdown lifts, cases started to spiral, the position could be worse than this. But that's what we're headed for right now. And this means that states must start preparing. If Delhi thinks that there's going to be 104,000 cases in Delhi, let's say a month from now, let's say half of them are active cases, 50,000 cases or so, you can predict that about 10,000 to 12,000 beds are going to be required. Start planning for that. Start planning for that right from now, so you aren't taken by surprise. Okay, let's quickly bring you up to date with the rest of the big stories.
In the biggest single-day spike so far, India recorded 9,851 coronavirus cases and 273 deaths in the last 24 hours. According to the Health Ministry data released on Friday morning, the total number of COVID-19 cases has gone up to 226,770 and the death toll stands at 6,348. Last few days, India has seen a sharp spike in the number of infections since the lockdown restrictions have been lifted. The Supreme Court on Friday sought centre's response on fixing a cap on COVID-19 treatment by private hospitals. Earlier, the court had asked the government why can't private hospitals who've gotten free land from the government treat poor COVID-19 patients for free. The court had asked the government for a list of such hospitals. The court will again hear the matter after a week. Any employee residing in a COVID-19 containment zone should be allowed to work from home and the period should not be counted as leave, the Health Ministry said on Thursday, listing out rules for reopening of offices. The new SOPs say an entire office building need not be closed if 1 or 2 cases of COVID-19 are reported there and work can resume after disinfecting the premises. However, if there's a larger outbreak, the entire building will have to be closed for 48 hours. Hand sanitizers and thermal screening provisions are must at the entrance. Offices in containment zones will remain closed.
15 days should be enough time for states to send migrant workers stranded in cities across the country since the imposition of nationwide lockdown home, the Supreme Court said on Friday. The top court also asked all states to create employment opportunities for migrants returning home. The hearing comes days after the top court took suo motu cognizance of the issue and passed several orders to help migrants reach home. The centre said over 4,200 Shramik special trains have run till June 13th to transport 1 crore migrant workers to their homes across the country.
Delhi recorded 1,359 fresh coronavirus cases on Thursday, which took the capital's COVID-19 tally past the 25,000 mark. The death toll due to the disease mounted to 650, authorities said. The highest single-day spike of 1,513 cases in the national capital was recorded on Wednesday. A total of 44 fatalities were reported on Thursday. Meanwhile, in an order on Thursday, the Delhi government said 56 private facilities were directed to reserve a proportionate number of beds for COVID-19 patients in the EWS category. Amid reports of people being turned back or made to wait for a long time at hospitals, the Delhi government has issued a new standard operating procedure for treating coronavirus patients. According to the rules, COVID-19 patients shall be brought to the triage area from the ambulance without asking for any details. The process must be completed in 15 minutes and doctors on call must attend to the patient within an hour. If beds are not available at the hospital, then it will be entirely the responsibility of the hospital to transfer the patient to another one.
Epidemiologists at the state-run Dr. MGR Medical University have estimated that Chennai may see 1.5 lakh COVID-19 cases and around 1,600 fatalities by the second week of July if the current rate of growth holds. The university manages the medical colleges in Tamil Nadu and its estimations have been done by the government for COVID-19 preparedness. The medical varsity started its projections from April 18th and presented it to the government in the first week of May. According to the predictions of this team, Tamil Nadu may see 1.3 lakh novel coronavirus cases and 769 fatalities by June 30th.
Odisha Chief Minister Naveen Patnaik said that the state government has announced weekend shutdown in 11 districts in order to reduce frequency of people coming out of their homes in the ongoing month of June. The Chief Minister said that the restriction would mean that people will be at their homes for a full 8 days in the month of June, news agency ANI reported. Odisha has reported close to 2,400 coronavirus cases and 9 deaths so far.
Renowned journal The Lancet has issued a statement of concern after over 100 scientists from around the world flagged discrepancies in its recent study linking the malaria drug hydroxychloroquine with increased death risk during COVID-19 treatment. The medical journal has withdrawn the paper published on May 22 that was based on a database from an Illinois company, Surgisphere Corporation, and analysis of some 96,000 patient records, the authors claimed. Among major issues cited by scientists are concerns that there was no mention of the countries or hospitals that contributed to the data source and no acknowledgements of their contributions. The research scandal threatens to undermine confidence in one of the world's top medical journals amid a pandemic. The findings reportedly led the World Health Organization to temporarily suspend clinical trials for the drug.